Dr. Gani, what are the risk factors associated with fungal infection in patients with cirrhosis?
Some patients with immunocompromised, like patients with liver transplantation, post liver transplantations, the risk of fungal infections become bigger. So we have to remember the fungal infections be can be complications in patients with liver cirrhosis. Other than that, the liver cirrhosis itself, it's kind of a immunocompromised also in this patient. So we have to give also the attention for the chance to have fungal infections, especially in patients with long-term antibiotics use. So that's something that we have to remember in patients with liver cirrhosis.
What other things should be considered for early diagnosis and treatment?
For early diagnosis, of course, a study said that early treatment with antifungal therapy will increase the likelihood of healing, yeah, in patients with fungal infection in liver cirrhosis. So if the patients it's in the risk factors for fungal infections, the diagnosis for fungal infection should be seek either with the use of the galactomannan, yeah, or beta glucan is recommended. So for the treatment, the use of anidulafungin or mecafungin may be preferable in this patient because of the less hepatotoxicity.
The meeting is called the Golden Age of
Yes.
Hepatology.
Mhm.
What's the meaning of that?
As we can see, this era, many liver disease that previously cannot be treated properly now have a good chance for treatment. For samples, hepatitis C. Hepatitis C, 5 to 8 years ago, we cannot have 100% chances of recovery or heal or eliminations for hepatitis C. And now, with the advancement of treatment for hepatitis C, some combinations of treatment showed very good results, efficacy for treatment of hepatitis C, and even 100% can be healed with hepatitis C. Liver cancer is very devastating illness, and until now, it's still the quite risk of quite some major problems in treatment of liver cancer. But the data in the latest data we can see the prolongations of survival in patients with liver cancer with the use of TKI or maybe immuno immune drugs that that helps patients with the liver cancer. So that's something that we have to stress out, and this is the golden age for pathology, and this golden age should be uh, the moment of all the hepatologists to put their maximal effort for the benefit of the community. I think that's something that maybe the message we want to share.
A large representation of Asian hepatology is
Mhm.
missing from the meeting from China.
Yes.
Are any special considerations being given to presenting the meeting to the Chinese as they are in China?
Mhm. Yes, we work with our collaborations with the Chinese collaborations, and we do the teleconferencing and also webcasting with China. This 4 days meeting already in webcasting. So Right now, you can anybody can follow up the meeting with for outside China. Maybe you can follow up with the YouTube, and in for the China for inside China in mainland China, they our collaborations with the Chinese corporations make it the webcasting available in for Chinese doctors.
Your fellow Chinese hepatologists will be hearing your interview.
Yeah.
If they were in this room right here and you were to give them a word of encouragement,
Yes.
what would you say to them?
First of all, we are share the sadness, yeah, regarding the coronavirus transmissions and also some mortality in China. And lastly, we already have the patients also with the coronavirus. This is not only Chinese problems, but the worldwide problems. So we share the concern, yeah, for coronavirus. I want to give them the perspective of liver development in Asia through the webcasting, and I really hope that they can follow up the meeting as in so many APASL before. The Chinese group is they usually have plentiful of doctors that come to the APASL. So this is the kind of our collaborations with the Chinese people.
Very good, Dr. Gani. Thank you
Thank you.
very, very much.
Thank you very much.